The year is 1981, and in New York and Los Angeles, small groups of previously healthy, young, gay men contract rare forms of cancer and pneumonia caused by compromised immune systems. This marks the beginnings of the AIDS crisis in the United States. And as a nation, we take action. The scientific community gets to work, and a number of organizations are born with the desire to care for the sick and at risk. The year is 1987, and Ryan White, a child from Kokomo, Indiana, is thrust into the spotlight and becomes the face of HIV advocacy and inclusion. He becomes a champion of compassion over condemnation, love over hate, and hope over fear until his death 3 years later. And we carry on his legacy. It's the 1990s, a time of advancements in treatment and policy, improving outlooks for people living with HIV, and we pioneer new services aimed at prevention. It's the start of the millennium, a generation after the fight against AIDS and HIV began, and the challenge is evolving. People living with HIV are increasingly diverse, and we adapt with new, more inclusive strategies. It's August of 2020, and we face an unprecedented challenge, a global pandemic caused by COVID-19, disrupted by the virus, our economy struggles, uncertainty, and unemployment rise, and a movement to create genuine equality is underway. These are the conditions to which we must respond today. The time is now to join together as advocates, politicians, and citizens and unite. This is how we overcome racism, poverty, and oppression. This is how we do better. This is how we thrive together. This is how we make HIV history.
Friends, it is a privilege to join you for the National Virtual Gathering to make AIDS history. On behalf of all the House Democrats, I thank Cleve Jones, John Cunningham, and the National AIDS Memorial for their leadership to keep alive the stories of all we have lost to HIV/AIDS, and to fight to finally banish this devastating disease to the history books. This panel is distinguished by the participation of so many leaders: Senator Tammy Baldwin, Congresswoman Barbara Lee, Mike Gifford of Vivent Health, Dazon Dixon and Diallo of SisterLove, and Jesse Milan Jr. of AIDS United. Today we mark two important milestones for the LGBTQ community and for our country. 30 years ago, the passage of the Ryan White Care Act, which has been an essential lifeline for those living with HIV/AIDS, and soon, 35 years since the creation of the AIDS quilt. Last year, it was my great honor to be with all of you and Representative John Lewis at the Library of Congress to celebrate the transfer of the AIDS quilt to the Bay Area after 2 decades in Atlanta. As we celebrate the progress that we have made over the past 40 years, from the Ryan White Care Act to HOPWA to PEPFAR, we look forward to the progress that remains to be forged. We need a committed, courageous, and comprehensive federal response to finally destroy HIV/AIDS. And to do that, we need to elect leaders who believe in evidence and science and have empathy, and also have respect for what John Lewis would call the spark of divinity within all. Together, we can make AIDS history. Thank you for your leadership and for your courage.
Welcome to Make HIV History, a national virtual gathering. Thank you so much to Speaker Nancy Pelosi for your message and for your historic commitment to HIV, going back to before your time in the House of Representatives. Today is truly historic. It's a one-of-a-kind virtual national gathering, bringing together thought leaders, advocates, people affected by HIV, and elected officials, all to engage in a conversation on what it will take to end HIV in the United States. We are being brought here today by Vivent Health, which is one of the largest providers of integrated, comprehensive HIV prevention, care, and treatment services in the United States, serving more than 10,000 people impacted by HIV. And we want you to join us today and take part. We'll be reading your comments in the chat box, so feel free to comment. And we'll be doing our best to include your questions in our conversation with our panel today. So we'll try to cover as many of your questions as we possibly can. And now we have a great panel to introduce you to. It's so exciting to see these folks join us. U.S. Senator Tammy Baldwin has been a tireless advocate for enlightened HIV public policy since she first entered public service. Elected to the U.S. Senate as the nation's first openly LGBT member, she has been recognized for her long-standing leadership in the fight against HIV. Congresswoman Barbara Lee is a fierce advocate for ending HIV and ensuring an AIDS-free generation. Since entering Congress, she has authored or co-authored every major piece of HIV/AIDS legislation. And in 2011, Congresswoman Lee formed the bipartisan Congressional HIV/AIDS Caucus, which she co-chairs. Jessie Milan is president and CEO of AIDS United, the nation's oldest and most successful HIV advocacy organization. Jessie is a person living with HIV for over 3 decades and currently serves in numerous leadership roles in the HIV policy community. And Dazon Diallo is founder and president of SisterLove, the first women's HIV/AIDS and reproductive justice organization in the southeastern United States. Dazon is recognized visionary and advocate in the struggle for human rights, sexual and reproductive justice, and the fight against HIV/AIDS. And here in the studio with me, safely socially distanced across the room, is Mike Gifford, the president and CEO of Vivent Health, where he has been a leading force in the fight against AIDS across the country for more than 27 years. Under his leadership, Vivent Health is now one of the nation's leading HIV prevention, care, and treatment providers with locations all across the country. So each of our panelists is going to start us off today with an overarching view of our topic. We're going to take a moment to share their thoughts and lessons learned on our nation's response to HIV and AIDS. And we'll start with you, Senator Baldwin.
Thank you so much. And I want to start by thanking Vivent Health for inviting me to be a part of this incredibly important conversation. And I'm honored to be joined by today's panelists, and I certainly want to give a shout out to Congresswoman Barbara Lee, who you'll hear from shortly. I had the honor of serving for 14 years in the House of Representatives with her, and I know so well her leadership on issues related to healthcare generally and HIV/AIDS specifically. Now, while the spread of COVID-19 has ravaged throughout our communities, this pandemic has exposed anew the health disparities that have existed long before this current crisis, and that we are continuing to try to combat today. This, of course, includes the HIV epidemic, which remains a major and urgent public health crisis in our country. Now, despite medical advances and scientific breakthroughs, people living with HIV still to this day face significant physical, financial, and stigma-related barriers to quality health care. And I've long fought to secure critical federal funding for HIV prevention programs and other efforts aimed at building healthier families and saving lives across Wisconsin, across America, and throughout the world. Now, more than ever, we have to work together to break down the barriers for folks who need access to HIV testing, support, and treatment, and renew our fight against long-standing racial, ethnic health disparities, and urge our government to also continue to gain greater understanding of the health disparities that exist with the LGBTQ community. And we have to fight back against the stigma that has long been associated with HIV, particularly the populations who have shouldered so much of the burden of this disease, to ensure that all individuals are able to lead healthy, happy lives and access the care that they need, regardless of their HIV status or various identities. And it's why we are joined together to discuss the challenges we face to the solutions we need so we can make HIV history. I'm so looking forward to the conversation, and thank you for allowing me to be a part of it.
Thank you. Thank you so much. Congresswoman Lee is up next.
Thank you, Pam. Can you hear me?
I can.
Okay, well, first of all, thank you so much for bringing us all together with this phenomenal panel. I say these are warriors, each and every one on this panel. I know the work, and we couldn't do this work without you. I wanted to, yes, give a shout out to Senator Ball and say how much we miss you in the House, but we are so happy you're in the Senate. We know we covered it. And also how much I thank you for making sure, even though we're not there with you physically, this convention has been truly awesome. I mean, it shows the creativity of your state, your creativity, and all of those who helped pull this virtual convention together so that we could all be together. And so you all have set a new standard, Tammy. And I just want to give you a shout out and thank you for that. I miss you tremendously, but this is really, truly successful because of what you have done in your state. Let me just take a moment just to say how important this moment is as we talk about, yes, an AIDS-free generation by 2030, but also making sure that HIV is history. I got involved in a very active manner around the whole HIV/AIDS pandemic there through ACT UP. A woman who was in her late 90s called me in the 1980s to come down to the post office and told me her name was Maudel Shirey, and she passed away at 104 years old. But she was a woman in Berkeley. She was the granddaughter of slaves who said, Barbara, you have got to come down here to this post office now and get with us, get with ACT UP. Too many people are dying and you have got to take this on. And I wasn't even elected to the California legislature then. Well, ever since then, I've been acting up. And I think this is a moment to continue to act up. And I wanted to just say that we have to, as we move forward, put this in a political context also, because we have got to make sure that we elect a White House that really understands that we need to move forward to seek an AIDS-free generation and make HIV history. And the way we do that is register to vote and vote in spite of all the obstacles that are being put up. And in our community, the LGBTQI community, the HIV/AIDS community, we all have to join together and work to make sure that we win this election. Finally, I will just say that we and all of the panelists understand working in an intersectional fashion and manner to make HIV history. We have got to understand that racial justice and equity is a key component to making HIV history. And the challenges in the African American community and Black and Brown communities are extremely important to lift up as we move forward and during this conversation, because there continues to be major inequities in our care, treatment, and prevention response as it relates to communities of color. So I just want to thank you so much for giving us a chance to have this discussion today, and just know that we're at that moment where we can either go forward and make HIV history and toward an AIDS-free generation, or go backwards if we let this administration and if we let the movement that I know is alive and well out there, but if we let the movement dissipate in terms of the noise and in terms of the level of our voices being heard in Congress, in state houses, and in local governments throughout the country. So we have to be, as Congressman John Lewis, our beloved John Lewis said, we've got to make good trouble and we've got to make more noise. Thank you again.
We hope to dive into a lot of those topics today, so thank you for bringing those up. And Jesse Mylan, why don't you go next?
Well, I'm happy to, and thank you, Pam, for leading this panel. And Senator Baldwin, thank you for being here. You are a trailblazer for our community, and we can't thank you enough for all that you do, And Congresswoman Barbara Lee, you are a hero, a shero for the LGBT and the HIV community. You have been a leader on both the domestic and the global fight against HIV and AIDS. And congratulations on the International AIDS Conference coming to Oakland and San Francisco. That was because of you. I love, Mike, the name of this panel, Making HIV History, because it implies both a past, a present, and a future. And I think we should just recognize that HIV has made significant history already. I couldn't possibly start this as a person living with HIV without recognizing the 600,000 Americans who have already died from AIDS and the 15,000 who are continuing to die every year. If we weren't recognizing the 15,000 who are continuing to die, we wouldn't need to have a panel like this. And I think we also have to recognize the 1.2 million people like me who are living with HIV, so many who are working very hard to attain an undetectable viral load. And I know we'll talk about that today, but still 15% of the people living with HIV in this country don't know that they have HIV, and a significant number are not in treatment and care. So in order for us to make history, we have to get those issues taken care of. More people to know their status, more people in care, more people virally suppressed. But I think the history of the HIV epidemic also reveals how HIV has helped expose to all of America and the world the importance of LGBTQ health and the importance of LGBTQ rights. It's exposed racial inequities, especially health disparities. And I think it's also exposed some regional disparities. We often have thought about the regional disparities in a global sense, but the regional disparities here at home, particularly in the South. And the history of HIV is also a history of grand legislation and important policy change. And we should talk about that today, the Ryan White legislation, the National HIV/AIDS strategy, and of course the Indian epidemic. So we have a lot to be grateful for that has happened, but a lot to be pushed forward to, and a lot to recognize that has already made history.
Thank you so much. So much work to be done today. We'll get to all these topics. Up next, Dazon Dixon Diallo. Introduce yourself, Dazon.
Thank you so much, Pam. And I am grateful also, Mike, for the vision in this conversation in terms of looking backwards, not even looking backwards, but living in the present, thinking in the future, and learning from the past. And that's, I think, what Making HIV History is about. It is also about recognizing the role that HIV has played, not only in what Jesse has acknowledged, around how we have galvanized all kinds of systems in public health, but also in science and in research, and in activism and advocacy and policy, affecting policy change. I work with an organization called SisterLove, and we're now 31 years old. And one of the things that excites me about having this conversation today is that we have a different kind of story to tell today than what we told way back in the early days of the epidemic. I too, Congresswoman Lee, I remember those days. I'm an ACT upper from the South, right here in Atlanta, where we were involved in 1990 for almost 5 years for the fight for inclusion of women and other folks who were not yet being included in the AIDS guidelines. That there were women at that time who were not being diagnosed, who were dying, never getting an AIDS diagnosis, those who were sick, not getting an AIDS diagnosis and not being able to benefit from the social safety nets that were created and that were available to men. And so we led that fight. What it says, though, is that we started in this in every sector of the HIV community, fighting for visibility and for inclusion, for equity, and for justice, and of course, for the access to the healthcare and the science that we need. And with all of the amazing advances with the science, with the advocacy, with the greater visibility of people living with HIV, we're still fighting some of those big issues around visibility and inclusion and stigma and discrimination and access to health, and making sure that everyone is counted and that the epidemiology and the funding go together, that the resources to fight the epidemic and to end the epidemic go where the epidemic actually is and where it's doing its most damage. And so in where we are going with this conversation and the work that sits in front of all of us, including Senator Baldwin, who has championed us in the Senate as well as in the Congress when she was there. And I've certainly followed you, Congresswoman Lee, from day one almost, and have been really grateful for the championship that you have led at the legislative level, but also in the community and at grassroots and in the world. I think I see you more internationally on these issues than we do here at home. We'll fix that now that we're virtual. I think that what we do with this conversation today becomes important for everybody, because most people are very complacent about HIV right now. We're right at the dawn of 40 years of fighting this epidemic when we reach next year. But what I see is what COVID is teaching us about what we already learned in terms of how we fight HIV. We have been here before, and there are those of us who know how to do this again, and we will.
Thank you so much. That brings up so many more good topics. So we're going to keep plowing forward here. Mike is going to round off the welcomes, and then we are going to dive into some of these really amazing questions you all are bringing up. Mike.
Thank you, Pam, and I want to welcome all the guests on the panel with me today. Thank you for making time in your very busy schedules. You know, when I think about lessons learned, the question that Pam asked, I think that they fall into two categories. Lessons that we can be proud of, the work that we've done to advance the cause, not only the fight against HIV, but the fight for equal rights for the LGBT community and the fight against racism, against African Americans and Latinx individuals and other communities, and the work that still lies ahead. And at Vivent, we're so proud of our champions, because at Vivent we don't have employees, we have champions, 450 of them across the country who are providing life-saving prevention care and treatment every single day, assuring unfettered access to care and the highest quality outcomes, really helping people with HIV thrive through the medical home model of care that we have pioneered and continue to innovate to assure that everybody has access to the care and treatment they need. And we're certainly proud of our partners across the country, partnerships that we formed in Denver and in Austin and St. Louis and elsewhere to give this life-saving, nationally recognized medical home model of care to others. That's certainly on the proud side, and all of us on the panel and all of us joining around the country can reflect on what we're proud of in the fight against HIV. There is so much work to be done, and I want to echo what my colleagues on the panel have been talking about. It is time to take a fierce stand to dismantle systemic racism in our country. We're all grateful that it has come to the national consciousness after George Floyd's murder and the murder of so many other people. Let's be really clear. I want to put a fine point on it. Racism kills. Racism kills through brutality and through violence. It kills through inadequate education and healthcare and economics and policies. And it certainly kills through AIDS. And we will never achieve our collective desire to end AIDS unless we confront racism and all become anti-racist. And we got to remember, it's not enough just to be anti-racist. We've got to overcome homophobia and transphobia and sexism too.
Thank you, Mike. We're going to dive into a question here now. We'll tee off on a question here, and then we may take a break and give all of you a breather. But Jesse, you brought this up. The 30th anniversary of the Ryan White program is tomorrow. Unbelievable, really, in some ways. And while it's been incredibly effective at helping patients succeed in treatment, it really only reaches about half of people living with HIV in the United States. So Jesse, we'll start with you. What do we need to do to promote health and ensure the sustainability of the healthcare safety net?
Well, thank you, Pam, for that. I just had the opportunity on Friday to give the closing keynote for the National Ryan White Conference. And so I'm very much in the mindset of the importance of the Ryan White program, because it really is a model for how healthcare should be created and distributed in this country. It makes it possible for people who are the least to get excellent quality healthcare, and I know that's true for Vivent. Vivent Health and the amazing work that they do. And so I think that the Ryan White program has helped spark the Affordable Care Act because its protections against for people with pre-existing conditions is very much rooted in our experience and our advocacy in the HIV community. The importance of expanding to Medicaid to more states where the eligibility requirements need to change so that single people who are not the parents of dependent children can have access to health care, especially those who are poor. And I think that those parts of the safety net have to continue to grow and be strengthened because the Ryan White program is a model for both men and women and children to have excellent health care. But that model should be replicated, especially through the opportunities created by the Affordable Care Act and the expansion of Medicaid.
Senator Baldwin, I see you shaking your head vigorously. You're agreeing.
Yes, well, I do want to say that the Ryan White Act is critical, and yet it only covers a small part, frankly, of the treatment and coverage for people with HIV patients. And in Congress, we've been fighting a couple of battles for several years, and that is the attempted rollback of the Affordable Care Act. They first tried to do it outright through congressional repeal. Now the administration's in court to this day trying to have the court overturn the Affordable Care Act. And we know that that act, among many other things, created a prohibition for insurance companies to discriminate against people with a pre-existing condition. And of course, HIV/AIDS would be a pre-existing condition. If that were overturned, it would be devastating. We've also seen some states that have failed to expand their Medicaid programs. Sadly, I am in one such state, and those resources would be very, very helpful. Also, this administration has promoted what are called junk plans. These used to be very short term, now they can be up to 3 years, that aren't required to cover people with pre-existing conditions. And during this pandemic, we have seen the uninsurance issue get worse and worse. I also want to just note one other thing that has become clear once again during the current coronavirus pandemic, and that is that public health resources in many communities are under-resourced. And part of what I've seen as I've interacted with public health leaders at the local level in my state over the coronavirus pandemic is limitations in their ability to communicate important messages for communities to keep themselves safe, whether those are language barriers or staffing resource shortages. There is a lot more we have to do to reach the people who really need the information to prevent and get early intervention to prevent transmission of HIV, as well as to be healthy if one is HIV positive.
And Mike is here on the front lines on this every day. What are you thinking, Mike?
You know, the Ryan White Care Act provides such a great foundation for the response to HIV, but I really appreciate what Jesse and what Senator Baldwin said about the importance to expand Medicaid and even take Obamacare further. You know, we really have to look at the entire safety net that people with HIV rely on. And what are we seeing right now? We're seeing dramatic reductions in income through reduced unemployment benefits. We're seeing less access to food through a strangulation, honestly, of the SNAP program that isn't providing basic nutrition any longer to the people that we serve. And there's a lot of other services that are at risk with the public charge rules that this administration have proposed. Thankfully, a judge has put them on hold. We need to reverse all of those things. We need to invest in Ryan White. We need to provide greater access to health care, fully fund and expand Medicaid, make sure there's a public option for health care, so important. And then we need to hold providers and insurers accountable, investing in those who are performing well and setting the rest aside. Beyond that, I would call on Congress to enshrine DACA in legislation, address the rollback of trans rights in healthcare. We're certainly grateful for that Brooklyn judge yesterday who put a stop to that, but we need to do more. We can't rely on judicial rulings because the Supreme Court is unreliable on that issue. We need to make sure that Congress is stepping up and addressing those issues. We need to make sure that we decouple healthcare from employment. Healthcare in this country has got to become a right. Right now it's a privilege, and that's not good enough. We need healthcare in this country to become a right if we're ever going to get to the end of the AIDS epidemic.
So much more to come, too. Thank you, Mike. Representative Lee and Dazon, we'll get to you after we take a short break. We've got great partners helping us today, not only with the work of ending HIV, but also supporting this very event. And right now, we want to hear from one of them, John Cunningham, at the National AIDS Memorial in the Bay Area of California. When we come back, we will dive back into some more great conversation, so don't go away.
The National AIDS Memorial stands as a marker in the national landscape to the tragedy of HIV and AIDS. Last year, the National AIDS Memorial acquired and will be the stewards of the AIDS Memorial Quilt in perpetuity. Bringing these two organizations together, these iconic memorial features, will allow us to tell the stories as well as to take the quilt, which is one of the most powerful social justice teaching tools, across this nation and around the world. As a person living with AIDS for over 2 decades, I never thought that I would have to live through one pandemic, let alone a second. They're very different in many ways, but there is a thread that we must pull through that does connect the two pandemics. And unfortunately, that thread is rooted in stigma and discrimination. I believe that there will be positivity that comes out of the COVID-19 crisis and brings about profound change in our society, as the HIV and AIDS crisis did as well. Now please watch as volunteers for the first time ceremoniously unfold panels of the AIDS Memorial Quilt in the National AIDS Memorial Grove, symbolizing the joining together of these two iconic symbols of the AIDS pandemic as part of the National AIDS Memorial in perpetuity, so that the lives of those lost to AIDS are forever remembered.
Make HIV History, a national virtual gathering, is presented by Vivent Health. To learn more about their mission in action, visit viventhealth.org.
And thank you to John and all the folks at the National AIDS Memorial. John mentioned the important role of art in overcoming stigma. HIV stigma still remains one of the greatest barriers to care for people living with and at risk for HIV. So our next question dives in there. What should the federal government do to help combat stigma? Well, you didn't get a chance to talk last time. Let's start with you, Representative Lee.
Thank you very much. Well, first, let me just say I associate myself with the response and the comments of all of our panelists, our phenomenal panelists earlier. And just want to add one thing to that, and that is, as a member of the Appropriations Committee, we in this year's budget increased the $2.4 billion for Ryan White by $25 million. Not enough, but we're working just on an appropriation strategy because the clinics and the providers who receive the Ryan White funds do phenomenal work. And we also must increase the funding through the Minority AIDS Initiative, also to create more access to communities of color, which, again, Congresswoman Waters and myself started in the late 90s. On HIV and stigma, first of all, you would think that by now, stigmatization were over. And let me give you just a bit of history on this. We at the United Nations had a UN commission on HIV and the law. And what we wanted to do during on that commission, I was the only American on it. We went around the world to look at laws that stigmatize and criminalize those with the virus. I said then, look, we're traveling all around the world holding hearings. Why don't we do something in America? And people looked at me like, what are you talking about? I said, yes, in our own country, because I know that part of the issue is, coming forward and the stigma and the criminalization that results as it relates to being able to seek care and treatment. And so I convinced them to do that. So we had a hearing quite naturally in Oakland, California. And lo and behold, we learned that the United States is one of the worst actors as it relates to the criminalization laws that are on the books throughout the country. This is still something that we have to address. And so what I also learned was that my state of California was one of those states that still had these laws on the books, which were enacted during the Reagan administration. And I think then it was 35 or 36 states criminalized those with the virus, with HIV. And so fast forward to what we did. I introduced legislation that would require and that legislation is still there, require the Department of Justice to work with states to get them to repeal these laws. And then I went around the country and we found that state legislatures were very resistant to this. And it took a while for me to get an author of a bill in California. Finally, our great hero, Scott Wiener, stepped up and he passed California's repeal, which was probably the second. I believe maybe Iowa was the first, but California was the second or third. But we still have these laws on the books, which actually criminalize those who have the virus. And so we have got to make sure that we move forward and get this legislation passed and require the Department of Justice to get these laws off of the books. Because until we do that, people will be concerned about coming forward, seeking help, seeking care and treatment. And under the Obama, and I'll conclude by saying this, and again, going back to why it's so important that we get rid of this regime now in the White House. Under the Obama administration, even though we did not pass legislation, they actually directed the Department of Justice through executive order to follow the legislation and do the regulations to try to begin to work to get the states to really repeal these laws, because it is a state issue. And so I'm just encouraging you all to support my legislation and then again, try to get your state legislators to repeal these very backwards and deadly laws, because they're still being used to really criminalize those who should never, ever end up in court or in the criminal justice system throughout this United States of America. We're one of the baddest actors in the world.
Jesse, as a person living with HIV, your thoughts on stigma?
I so agree with Congresswoman Lee that in this day and age we should be over this, especially 5 years after a Supreme Court ruling on same-sex marriage, because so much of the stigma around HIV was rooted in the, as Mike said, homophobia in our community. But the stigma continues because people are simply afraid of what's going to happen to them if they find out that they're HIV positive, whether they're going to lose their job, as Congresswoman Lee has said, whether they might risk going to jail, and that's still true in 30-odd states, for possibly transmitting this virus to someone else. The stigma around use of drugs. Syringe access is a major problem, and it's time for us to have a conversation nationally about the importance of prevention for people who are using drugs, and understanding that that modality is important, but it also continues to promote the stigma if we're not talking about it. So I think those issues, plus the racial inequalities that Mike has already described so well. Black men and black women afraid to know their HIV status because what the community might think about them. And if we're not working as a federal government to help change the conversation to say, we want you to know your status, we want you to get in care because you can live and you will be honored and loved as a whole person and not cast aside or not disparaged because of your HIV. That's how we get rid of the stigma, and that's what we need our federal government to help us do.
Dazon, go ahead. Yeah, go.
Yeah, no, thank you. What I would add is I am in absolute agreement with Congresswoman Lee and with my dear friend Jesse, and especially in at the national level and in the battle that he is in the leadership of. I also think that if we're thinking about racial justice and we're looking at what prejudice and what biases do when they play out in systems and in institutions and in policy and in practice by actually discriminating against people, but more so is actually damaging people's dignity, treating people unequally. All of that starts with stigma, but ends up in how people get treated, not just how they're thought about or looked at. And that lends to some of those barriers and challenges that Jesse was just talking about. One of the things that I believe that the federal government can get a handle on is to stop bifurcating what it means to address HIV, both from a treatment and from a prevention standpoint. Many jurisdictions, many cities and states and different organizations are taking on status neutral approaches, which means that everybody has to get tested and know their status. And then no matter what your status is, there is a process for becoming informed, getting linked to care, getting linked to health care that is universally available to people. That in and of itself would address stigma in a lot of ways. And because we now have biomedical, we have pharmaceutical tools, both for people living with HIV to get to the end of the epidemic through viral suppression, and for people who are not living with HIV to stay HIV negative through taking a pill a day. And there are actually other delivery systems like shots and implants and those kinds of things that are coming down the pipe. If you knew that there was something you could do about HIV, regardless of your status, then that would begin to chip away at what makes people different because of that HIV status. Because where I work with women every day who live in these big intersectional spaces of dealing with not just HIV risk through their sexual behavior, but also HIV risk because there's violence, because they may be homeless, because they don't have equal pay, and that they are also, running, leading their households, caring for their children, their elders, and then having to take care of dealing with a health issue that's related to their sex and sexuality. These are the issues that by broadening how we approach prevention, treatment, and care for everybody would diminish some of that stigma and, by and large, end the discrimination. And just to add to that, that we're not quite yet there, because the whole idea of addressing HIV only in the context of it as a health problem. You've heard folks talk about the social determinants, about racial and gender and sexual identity, justice and equity. It is an issue of intersectionality at just about every social justice matter that you could come up with. And I will say this, that I would have said in answer to one of the previous questions, and I mean this in the domestic sense as much as I mean it in the global sense. We will have to find a way to center Blackness in this HIV struggle. It is not questionable that people of African descent, no matter where we are in the world, no matter what proportion of the population we hold, we carry the burden of this epidemic because of all of those other challenges that have been laid out. So if we center how we're addressing HIV on the continent, in sub-Saharan Africa, in Black communities in Latin and Central America, and Europe, and here in North America, then we have an opportunity to go a lot further for everybody else, because we would then be able to tackle the folks who are carrying the burden of the epidemic the most. And so if you circle that back around, stigma, racism, and bias all come together in how we treat each other and how we treat people, whether it's the criminalization of Black bodies, or whether it's the criminalization of brown bodies or female bodies or gendered bodies or non-gender conforming bodies or LGBTQ bodies, that the minute you start to treat differently, discriminate against, and withhold the access to information, education, services, and the best outcomes, then you're not addressing the stigma that we have to. You're not only not addressing the stigma, but you're not addressing the end of the epidemic. And I would say without women, we're not going to get to the end of the epidemic. And I know we're going to talk about that a little bit more.
We are for sure. Tammy, are you chomping at the bit? Go ahead.
Yeah, so in terms of steps that the federal government could take to reduce stigma, it could be to rid ourselves of policies and laws at the federal level that are not based on sound science, but and that also have the stigmatizing impact. And I'm just going to list one, but some context. We all remember with great horror hearing about the massacre at the Pulse nightclub in Orlando. And one of the things I recall in watching the coverage while grieving that heinous attack, and it was targeted on a night that the Pulse nightclub was having its Latinx night. And the next day, hundreds of people lined up to donate blood because they felt like that was an action they could take. And many probably learned rudely at that moment that men who have sex with men had a lifetime deferral on being able to donate blood. And that is not science-based. And so I think, now I will tell you that it was 12 months after that, and now it has been moved actually down to 3 months, showing that the earlier lifetime ban on blood donation for men who have sex with men wasn't grounded in science. But having those policies sort of deepens the stigma, and we should be basing all of our blood donation and other policies based on the science, not having something that creates additional stigma.
Yeah, thank you for bringing that up. Dazon, you touched on this. The HIV has long been known to have a disproportionate impact on communities of color. And so we'll close out this segment with you, Mike. What are your thoughts on what can we do about that as we move forward?
You know, it's just a sad reality in the fight against AIDS, that racial disparity. And Dazon, I appreciate so much how you talked about how stigma leads to that once we get people tested for and in treatment. And there are a lot of barriers out there that we need to address, a lot of policy changes like the unemployment benefit and the SNAPs benefit and public charge that I talked about earlier. But, you know, one of the great things about the fight against HIV is that we can overcome all of these. And I just want to use this moment in time. All these important issues that my fellow panelists have been talking about are critical, and we know that we can overcome. And I just want to use one example of it. At Vivent Health, we have eliminated the racial disparity in health outcome between our Black and our white patients and their viral load suppression. It's the gold standard, the most important clinical marker of how your HIV is treated. And we've eliminated that in our Denver operation. Actually, Black patients do better than white patients in our Denver operation right now. And there's a lot that we can learn about that. We can learn that you have to address the social determinants of health. You have to put the patient at the center of care, and you have to remove the barriers around access to payers and such so that people can get into care and treatment. We're on the precipice of doing it across the country at Vivent. We've done it in Denver. So all of these critical issues that the panelists have raised, I concur with. You've spoken very, very effectively around. And we know, because of things like the Ryan White Care Act and Medicaid and the community response to AIDS and the federal leadership we've gotten from people like Congresswoman Lee and Senator Baldwin, we can overcome these things.
Thank you, Mike. Well, coming up next, we've got a message for you from one of the original HIV activists, Cleve Jones. Cleve has been involved with the HIV movement since the 80s and continues his advocacy still today. So take a look, and we'll be right back.
Hello. I'm very pleased to be part of this national virtual gathering sponsored by my friends at Vivent Health. It's a wonderful organization that's making a huge difference in the lives of thousands of people who, like myself, are living with HIV. In my book, I begin by saying that the movement saved my life. That's not hyperbole, that's not rhetoric. I was very close to dying. And thanks to organizations like ACT UP and so many others, I got access to life-saving treatments before they were approved by the FDA. It made the difference and it pulled me back from the brink. Today, advocacy remains critically important in our fight against HIV/AIDS and also the new pandemic of COVID-19. The reality is that nothing good happens in this country unless people fight for it. And it's important for us to remember all of those who marched and fought and got arrested and lobbied and wrote letters and voted, that's really what made the difference. Tomorrow, August 19th, happens to be the 30th anniversary of President George H.W. Bush signing into law the Ryan White Care Act. This was an incredibly important piece of legislation that was a lifeline to state and local governments who were being overwhelmed by very, very sick patients, dying, hospitals filled. The communities affected and the governments that represented them simply could not meet the challenge. And then, in a remarkable example of bipartisan leadership, Senator Ted Kennedy and Senator Orrin Hatch co-sponsored the Ryan White Care Act, and it was signed into law by a Republican president after being passed by overwhelming majorities of Democrats and Republicans in the House of Representatives and the Senate. It's important today, as we face the current challenges, to remember what can happen when people stand up, demand justice, demand equality, demand health care, and when legislators on both sides of the aisle set aside their differences to do what is right for the American people. Don't ever doubt that you have power. And there are many people who would prefer that you think you do not. But what you do matters. The decisions you make, the actions you take, they all matter. Please, don't ever forget that. Thank you.
In the fight against HIV, nothing short of a champion will do. Visit viventhealth.org to learn how you can join us in our mission and become a relentless champion to end HIV.
Those were powerful words and a great reminder from Cleve about the need for everyone to have access to health care. But we know there are so many barriers for people of color, the LGBTQI community, and others who are often marginalized. Right now we have a question from one of our viewers. I think we'll throw this to you, Senator Baldwin. The high cost of medications is a challenge for folks with HIV and at risk. What can we do?
Well, certainly the high cost of medication is a critical issue impacting almost everyone who has a prescription in America. And I hear this across the board. But I really think if we hone in on PrEP, for example, pre-exposure prophylaxis, those are very expensive medications, and as a result, we see far fewer individuals getting access to PrEP to keep themselves safe and to use it as the preventative tool that it needs to be. In terms of prices generally, but for PrEP specifically, I think we have to call out the pharmaceutical companies and the whole opaque system we have for pricing drugs. Gilead charges exorbitant prices for PrEP, and they are the company that has developed both of the PrEP medications and several treatments. And so accountability across the pharmaceutical industry and the folks who distribute those medications to clinics, et cetera, is a really vital aspect of that. And then I think And I'm going to get into legislative ease right now, but there's a program called the 340B program, which helps hospital and clinic settings that serve underserved and low-income and uninsured patients be able to offer significantly discounted prices. That program has from time to time been under attack, and we need to make sure that it survives and thrives. So both of those strategies, I think, are critical, and the Congress needs to act.
Thank you, Senator Baldwin. We're going to try to plow through some questions here, and with respect to your time and our panels as well. I'll ask the panel to try to remain brief. I know these are deep questions, but Representative Lee, we'll go with you. How can you in the House and Senate rebuild bipartisan momentum to help end HIV as an epidemic?
Thank you for that question. And this has always been a challenge, but we've been able to step up and continue to make our responses and our leadership bipartisan. I do co-chair the HIV/AIDS caucus with a Republican. It is a bipartisan caucus, and we work together to try to make sure that one is our funding requests are such that they're bipartisan. Secondly, as it relates to, again, the Ryan White Minority AIDS Initiative, but also when you look at the global pandemic as it relates to PEPFAR, the Global Fund, we've actually, with Senator Frist and those who were in the Senate and in the House, Congressman Jim Leach, we've worked together writing editorials, because remember now, only 20, maybe 25% of the members of the House were actually here in the early 90s, in the late 90s, when we started working on these legislative strategies, with exception, of course, of Ryan White. But the Minority AIDS Initiative wasn't passed until I think it was 98 or 99. And so I'm urging and encouraging everyone to reach out to your Republican members. If you have members or family or friends who know members, and convince them to keep this bipartisan, because if you can have a Barbara Lee working with George Bush and Henry Hyde, we certainly can keep this bipartisan and move forward, because this is going to be essential, even as we move into the next, hopefully, administration. This is one area where they talk about bipartisan, where you hear it so much about there's no bipartisan cooperation in Congress, which for the most part, we are very polarized on most issues, but not on HIV and AIDS. And so this is a testament to all of those on the panel, but also to how important this is as a priority to the country and to the world, quite frankly. And thank you, Dazon, for talking about this should be Black-centered. And I'll talk about that a little later if I have another minute, because that's so important.
Thank you, Representative Lee, and thank you for your bipartisan leadership and all the efforts you make. Jesse, for you, young gay men, especially men of color and transgender people of color, are experiencing unacceptable HIV infection rates still today. How can the HIV care and treatment community and the federal government do better to work together to solve that?
Well, the disproportionate impact on communities of color is across the board, across all ages and modalities of transmission, but particularly Black gay men. You know, research has shown that for Black gay men, there is a 60% chance that you will be HIV positive by the time you're 40. So if you're an 18 or 24 or 28-year-old Black gay man, the inevitability that you will be HIV positive simply should not be. And among our sisters who are transgender, 44% of Black trans women are already HIV positive. So how do we stop that? I think we have to make sure that our federal government is actually speaking to the need to change those statistics, that the lives of Black gay men are valued, and to not shroud those or confuse those with inconsistent policies, as the one that Mike just described earlier, that a Brooklyn judge just stopped about today that would have made, through the religious consciousness option, the possibility that people could deny health care based on religious feelings about LGBTQ people. And I think that the transgender community needs to hear that they are valued and that it is important for them to stay healthy. And when these messages are heard and they are followed with the appropriations that Congresswoman Lee talked about, to make sure that there are actual programs targeting that community to help them understand the issues and to have access to care, then we can start to turn these inequities around.
And Dazon, to follow up on that, women, especially women of color and trans women, are facing also tremendous barriers to health care and access. So how can HIV prevention and care and treatment policies and programs better offer care for women?
Absolutely, Pam, and thank you, because it's a really important question for us to answer at this time. While a lot of the issues that we're talking about that are barriers for everybody who is living with HIV and or at risk for HIV, that for women, I think it's a little bit, not even a little bit, it's very different in terms of our approaches. Women, and especially women and people of trans experience, including those who are assigned female at birth, have an extra layer of health challenges with regard to our sexual and reproductive health overall. And so from a reproductive justice standpoint, the intersectionality of HIV, along with how we're able to access contraception, how we're able to access gender reassignment medications, how we're able to deal with folks who look different from what our expectations are, but have the same needs, are really critical. So for women, that means taking the issue of HIV and putting that back into the large context of our sexual and reproductive health. Most of the women that I work with, including trans folks, are not necessarily readily wanting to always go to an HIV provider or an infectious disease doctor, when a lot of their times, like for example, about 70% of women in the United States predominantly access their family planning and OBGYNs more so than they do their family practitioners and their ID docs. And so if we don't have HIV services, if we don't have information prevention opportunities like Senator Baldwin talked about with PrEP, then we are missing a whole swath of women in all of our diversities in terms of how we access our care, where we access that care, and what happens to us when we get there. Especially for adolescent girls and young women who are not getting comprehensive sexual health education, who are not getting the gender equity framework in the schools and in education, both with boys and girls, regardless of what they were assigned at birth, then they're already behind the 8 ball by the time they reach their age of sexual debut. And so if we're not addressing the totality of the experiences, including gender-based violence, which also is a huge factor for women of trans experience, especially Black women and women of color of trans experience, but all women, including Black women at the height of this experience, we know violence drives HIV and HIV drives violence. Domestic violence, violence at the hands of the state, sexual violence, all of those components. Most importantly, again, centering Blackness and then centering it in Black women, that's where we are going to be able to address so many of these key issues. Black women represent more than 2/3 of the epidemic in the United States. Black trans women are like 49 times more likely to get HIV than the general population would be. And in the world, it is Black women, especially adolescent girls and young women, who are occupying still the acceleration of the rate of HIV, especially in sub-Saharan Africa. So if we don't address some of these core issues around our very natural development as female bodies or as women identified people who have special needs with regard to being women, then we're not addressing all that they need in HIV. We are not just small men's bodies, and we should be getting messages that speak to us. And I'm meaning in terms of whether it's U equals U, which is about viral suppression and treatment adherence, or if it's about accessing PrEP in a pill a day or the other options that we need. Women must also be included in the research, and that's a big controversy right now, in the science, and also in benefiting when the science is proven effective and safe.
Dazon, thank you so much, and I hope people will look you up on the web because you're such a wealth of information. All of you, I hope folks will track you down to get more information. We're going to round out this segment. I know we're running late, but hang with us. This is an audience question on the opioid epidemic. It does continue to worsen in many communities, sadly, and we've seen overdoses increasing in the rates that are happening out there. What do we need to do to protect the health and lives of people who are injection drug users? Mike, this one's for you.
Let me start by echoing what I heard from Dazon and from Jesse. Young gay black men, your lives are valued. Women, your lives are valued. Women of color, black women, your lives are valued. Members of the trans community, your lives are valued also. And so are the lives of people who use and abuse and inject drugs. And our country needs to follow the science and completely rethink our response to the opioid epidemic. We need jails to be replaced by treatment centers. We need cops and judges to be replaced with physicians and social workers. And we need to follow the science. We know what works here. Medication-assisted therapy works. Treatment on demand works. Harm reduction approaches are so important. From needle exchange all the way through to even supervised injection facilities. We can turn the tide on the opioid epidemic if we look at it the way we should. The opioid epidemic is a medical condition, not a crime. And if we treat it as a medical condition with compassion and support, we can get to the end of the opioid epidemic.
Thank you, Mike. Lots of head shaking out there. We are going to take a break, though, Jesse, even though you want to dive in. It's time we have to take a break. And this person needs little introduction. Jeannie White-Gender has been a leading advocate for HIV prevention, care, treatment, and education ever since the 80s when her son, Ryan, was diagnosed with HIV.
I would never have dreamt 30 years later we'd still be talking about Ryan White and the difference he's made. And I'm overwhelmed at people who are living today and being able to have children and just being able to go on and lead productive lives. I mean, that is a reward within itself, really, that because of Ryan, people are living. I remember going to Roosevelt Memorial Hospital and Ryan being tested, and a gentleman came up to him. He said, "Oh my gosh, you're Ryan White, aren't you?" And Ryan sometimes didn't know whether to say, "Yes, that's who you are," or not. And he said, "Yes." He said, "Our whole community is running so scared, and here you are reading a comic book." He said, "I want to thank you for all you've done for people with AIDS." And Ryan turned around and he said, "You know, Mom, I'm the only one that really knows what he's going through. We're both fighting the same disease." So there was all these little things, I think, that came into Ryan's life that taught Ryan lessons about people and about how he wasn't the only one, and he saw how the gay community was being treated, and people were treating him the same way, and he didn't like it. He didn't like people treating him that way, so he sure didn't like people treating the gay community that way. So I think that's why he was more open, by actually seeing and meeting other people just like him. During that last week and a half of his life, Elton John was always there by our side, and he was at the hospital taking care of the media, any kind of visitors. And there was a phone call that came in, and Elton said that this is a call I think you should take. And it was Senator Kennedy, and he said, "You know, we're having these hearings on the Comprehensive AIDS Resource Act." And he said, "Nobody has brought so much attention to this disease, and we have people caring about the disease now. With your permission, we would like to name it the Ryan White Care Act." And at the time, not ever realizing how enormous that bill would become, but I said that would be nice. My concern was at the time was my son. It wasn't until after Ryan passed away on April 8, 1990, that just a couple weeks after that, I got a call from Senator Kennedy again. And he asked me, he said, "You know, we'd like for you to come to DC. We know it's very short after Ryan's passing." And I said, "Oh no, I'm an emotional wreck." Finally, my friends from AMFAR, the American Foundation for AIDS Research, and a lot of the guys that I know has worked so hard on this bill and dedicated their lives, they called and they said, do this for us living with AIDS now. And I was like, I'm afraid I would hurt the cause more than help the cause. And then Senator Hatch called me. Senator Hatch told me, he said, we're not going to take no for an answer. He said, I have 25 senators lined up for you. He said, we're going to approach this disease a little differently. He said, you just be a mom and tell these senators what it was like to watch your son live and die with AIDS. I still thought, oh gosh, I can't do this. And he said, this is a chance to make a difference for everybody living with AIDS today and tomorrow. It took me a while, I think, to realize the importance and how big this actually was. And it's making such a difference in people's lives that if you don't have insurance and you are going to be able to get treatment through the Ryan White Care Act. We lost so many at that time, and it seemed like they were just a number. And I said, they need to have a face, they need to have a story. And I think, you need to be able to talk about them. I'm fortunate that I can talk about Ryan and people want to know more. So I get to share Ryan with the world. But he ended up, representing himself with a smile. I mean, there was never no bitterness or hatred or anything within Ryan. My efforts have been small compared to Ryan. Ryan's face is what everybody remembers, and that's what I want to remember. I want to remember not the sad times, the bad times. I want to remember that smiling face. Mom, everything's going to be okay. I'm hopeful that I'm going to be around to see the end of AIDS. I'm 73. I want to see the end before my end. And that better be pretty soon.
Jeannie and Ryan's story of perseverance and compassion are timeless and constant reminders of the power of centering our work on the fact that we are talking about people, not numbers. Now more than ever, we all need hope in this world. And what is keeping us going these days? What is giving our panelists hope? We want to end today with a message of hope for all of you who've been watching and talking about the challenges today. Senator Baldwin can lead us off. Senator Baldwin, your message of hope as we go.
Very briefly, we just saw that message of hope. And I'm going to reference what Congresswoman Barbara Lee said in her introduction, starting as an activist with ACT UP. One of the most powerful mottos was silence equals death. I think that our voices and our visibility cancel them. And I am hopeful because more and more folks have stood up, told their stories, and created political change. I'm also hopeful because in the length of this, I have so many people that I love who are healthy and thriving because of the advances we've had in care and treatment. And all we need to keep on doing is plugging for the vaccine, the cure.
Representative Lee, would you like to go next?
Sure. Well, first, just in memory of all those we lost to AIDS, we have to be hopeful. We have no option. I'm hopeful because of young people. I'm hopeful because of the movement for Black lives and the intersectional nature of all of our struggles right now and fights for full transformation. And because of our young people, I'm hopeful that we will end HIV and make HIV history and see an AIDS-free generation. Look, we've lifted the travel ban. We've had a national HIV/AIDS strategy. We've not fully accessed for everyone, but PrEP is here to stay. We have to have hope that everyone's going to have access to PrEP. We have had two international AIDS conferences in America, in Washington, D.C., and yes, one in my hometown, and the speakers in Oakland, San Francisco, even though it's virtual. I have a lot of hope that what Dazon said in terms of this being Black-centered with women, when you look at what is taking place in sub-Saharan Africa and the African-American communities here in America, we've come together to look at best practices and to use the scientific research in ways that will lead us to an AIDS-free generation. And so I have a lot of hope because of the past and how far activists and all of you have led us to. But also I have hope with the Biden-Harris administration that they're going to run this next lap of the race with us to finally see the end of HIV in our lifetime, because HIV will be history and we will see an AIDS-free generation. I have a lot of hope because of our young people making sure that this country will be transformed in a way that there's justice and equity and health care for all.
Dazon, you're shaking your head.
Absolutely, and thank you so much, both Senator Baldwin and Congresswoman Lee, for your leadership and for the vision in how we're going to actually do this and get there. Instead of thinking about what gives me hope, I really want to talk about who gives me hope and how they show me that they give me hope. And I'm bringing it home. I am given so much hope by the young people who see HIV as much more, it is a public health issue, but see it much more as an issue of justice and of human rights and of dignity and love. And through that and the conversations and the activism and how they put all the pieces together and how they move it is overwhelmingly exciting. And right now you can see it happening because this week we're hosting, and this is a prideful plug, we're hosting what we call is the Healthy Love Youth Advocates Statewide Summit. It's usually together. This year it's virtual. It is called Hell Yes, and it is completely 100% planned and implemented, executed, and actually presented by people who are all under 30. Us old folks, all we do is say, how you need us, tell us what to do. And the things that they're coming up with and the strategies and the solutions and the movements that they're building are just phenomenal. The second thing is the women themselves who are living with HIV, who have stepped outside of the stigma, who have stood up in the face of all of the kinds of discriminations and shame and guilt and negligence that they get from their families. And this is another prideful plug. Every year we recognize women who are leaders in their communities who have been living with HIV for at least 20 years, because they actually are the people who have the hindsight and they have the foresight to give us the vision we need to get to the end of the epidemic, because their stories tell us what we need to know in order to know how to get there. And so I am grateful to them. I am thankful that we have an opportunity to say thank you to them every year. And you can tune into that with us at SisterLove October 16th. We got to keep this thing going because that's where hope lives.
Atta girl. That's very good. A prideful plug. I like that. So, Jesse, I'm thinking for 30 years, it must be so different today to talk about hope than in the Jeannie White and Ryan White era, when hope was so dashed over and over again, it seems. Talk about your hope and how that's probably changed a lot over the years.
Well, it certainly has changed over the years, but you know what? I just had a birthday 2 weeks ago, and the concept of HIV and aging, here's the face, and that hope was not there 30 years ago. Mm-hmm. That hope is here today. Mm-hmm. And so I look forward to a generation of people who understand that HIV does not have to consume your life. It can be a part, but it doesn't have to end your life. And so our conversation around rights and inequities that is happening all across this country gives me hope because of all the intersectionalities that Dazon described so brilliantly. LGBTQ health, Black health, brown health, red health, youth health, women's health, trans health, those intersectionalities with HIV, and the conversation about rights and inequities must continue so that we know that all of those people in every one of those categories has hope. I have hope because our conversation around access to health care is happening all across America, and COVID is helping us understand that having an insurance card in your pocket or in your pocketbook should not be something that a Black gay man who's 20 or a Black woman who's 20 or a trans woman who's 20 does not have. We need to make sure that this conversation grows to the point where healthcare truly is a right, and that right is something that everyone has in their hands. And lastly, we have the tools. U equals U. Obtaining an undetectable viral load means you can live a normal lifetime and not pass this on to anyone else. PrEP, a tool to make sure you don't get infected, and syringe access programs to make sure that you don't get infected. We have the tools now. We don't have to wait for a vaccine, because we can stop this epidemic now. And if we can put those tools in everyone's hands who fit into all of those intersectional categories, then we will end this epidemic, and that's what gives me hope.
Thank you. Thank you, Jesse, so much. Everyone's shaking their head on that one. Mike, I think I'll let you chime in next.
This is a tough crowd
it's a tough crowd.
There's no doubt about that. And before I talk about hope, I want to just give one shout out to an individual who helped envision and produce the event today. Bill Keaton, our Vice President and Chief Advocacy Officer, was a driving force behind the scenes, literally behind the screen right now, that made this possible. So thanks a lot for that, Bill. We need to move this Make HIV History from a title of a conversation to action. And I have great hope in that, because that's what the AIDS community has always done. And as an AIDS community, we need to do more and better and different things. And that gives me great hope, because we've got 40 years of experience in doing that. Even in these tough economic times, we can get that new funding I talked about, and Congresswoman Lee was a perfect example of it, and her advocacy in the House Appropriations Committee to get that done for us. We can get greater access to health care, and a perfect example of that are the people, the voters of Idaho and Missouri and Oklahoma, who recently have expanded Medicaid at the polling places. And we can get better policies. Thank goodness for the judges that we have, like that judge in Brooklyn. But we can get better policies through our elected officials as we all go to the polls to vote in November. It's very important that we make progress on more money, more access to health care, and better policies to address all these issues that we've been talking about today. But I want to end with one thing. It's those incomparable 8 minutes and 46 seconds of the knee on George Floyd's neck. That gives me hope. And what hope is the millions of people who have arisen in the streets of our society to say no more. All of us have marched, and we all need to continue to march. We all need to become anti-racist, and I think we all need to demand the dismantling of systemic racism in our country. And I have hope that we can even achieve that.
Thank you, Mike. Do you guys want to comment? Dazon?
Well, first I want to tell Jesse that he also just gave millions of people hope, because if that's the face, people hope that they have this face as they age with HIV. So thank you with that beautiful opportunity, Jesse. And just, Mike, I absolutely concur with you. I think that the movement building is happening because so many different issues are actually converging in anti-Black racism, in understanding how poverty is impacting that, how immigration is impacted by that, how housing is impacted by that, healthcare, education, that it is not just this one thing about the color of people's skins. It is about the experience in that color, in the skin that matters. And I'm so grateful to you for raising it. So thank you, thank you, thank you.
Jesse, the face?
This coalition that you see on your screen right now, Mike Gifford, Tammy Baldwin, Barbara Lee, Dazon, and me, that's the coalition that will make the difference. That's the coalition that is what America is about. And my heart is bursting because hope is right in front of us. And so thank you, Mike and Vivent Health, for putting this together. And thank you for the leadership of everyone on this screen, and for the leadership of all those people watching, because they're living and creating this vision of unity that is so needed to end this epidemic.
Yeah, Pam, let me just say, I will conclude by saying I also have hope, because finally this country is embracing the fact that healthcare is a basic human right, and that finally we want people to not only survive but to thrive. And I think that hope, given what we see taking place now, reassures me that our young people who are pushing us to do everything that we've been talking about will succeed. And so, yes, we must be hopeful in memory, especially of those who we lost much too early.
Tammy?
I just think about the history as we started this conversation, making HIV history, but understanding the history of this epidemic. I was 24 years old in 1986 when I ran for and won a seat on the Dane County Board of Supervisors. That same year, we had our first individual who was HIV positive moved to the county. I ran for the county board to work on healthcare issues, and I was also newly out as a member of the LGBTQ community. And I immediately understood intersectionality, immediately, because I knew that the stigmas that I was facing as an out lesbian, and those stigmas that my colleagues and friends in the LGBTQ community were facing, and this illness, this epidemic, were going to converge, and it was going to impact incredibly the path that we were going to get on. And we had an epidemic, and we had an epidemic of fear. And so the educational and communication piece of getting right into this is so critical. That's what everyone has just given voice to. And so I just want to thank everybody for your involvement, and looking forward to working with everybody moving forward to make HIV history.
Thank you. Thank you all so much. And I know we've taken more of your time than we asked for originally, so thank you so much for hanging with us as we dive into these deep questions that bother so many of us and keep us awake at night. So thank you also to you, the viewers, who've stuck with us a little bit long here. Today's event is obviously another jumping off point as we look toward fulfilling our mission of a world without AIDS and ensuring that everyone with HIV can live a long and healthy life. Vivent Health and our partners here today, all of our panelists here today, invite you to join us and follow on social media, visit the websites, attend the virtual events coming up, use your voices to lift up people living with HIV and ensure that access to health care and prevention is available to every single person who needs it, regardless of where they live, who they love, or their race, gender, or sexual orientation. So thank you, panelists, so very much. You were amazing. Thank you at home for joining us today. We wish you all safety and say take care. Thanks for joining us.
Thank you.
We shuffle around the paper.